Well, during my training sessions, people keep asking me, come on, Celine, what about urological disorders and diseases? Can't I come up with training in this field? What about slipped discs, prolapses? Well, I have to distinguish between whether I'm a trainer or a therapist. And we try to close this gap by talking about the possibilities and prospects of a medical EMS. Well, I often say, cobbler, stick to your last. Once I'm not trained, I do not have the skills and qualifications, I don't dare touch it, but all the better. We've got Thomas Beisswenger here. He will talk about how I can integrate EMS into my business in medical terms, and he refers to people's back here. So please welcome the physiotherapist, osteopathist, back trainer, etc. at the Waldenburg College, Thomas Beisswenger. So I would also like to welcome you very warmly. I'm very happy to be here at FIBO again, being able to deliver a presentation. I hope that you can learn a lot during my presentation. I would like to guide you through the topic. Well, the topic of back pain, people's backs, will take up one portion of my presentation. I would like to talk about the current status quo of the medical therapeutic situation. We will jointly take a look at market opportunities and potential of EMS as a product in the medical therapeutic application sector. Then we will briefly discuss quality matters. So why can training not be the same as the therapeutic approach to a problem? And then I will try to give you a potential solution as to how therapy and training can be linked to give us the possibility of working successfully with other target groups in a risk-free, accident-free framework. This is what I would like to convey to you today. What are we talking about? It's the interface between the classical therapeutic application of electromyostimulation, 1 to 4, and EMS training. We know from fitness and preventive areas, and most of you will work in this field. And the therapeutic topic is somewhere in between. So on the one hand side, it's about taking up training-related situations, something that is done very efficiently in the fitness area, and then the therapeutic contents, the principle of spot the defect, shortcoming, know your limits, and accept the borderlines you come up against. So the therapist can use the skills and expert knowledge in a dedicated way, and the fitness trainer out there in the market gets more certainty by being able to weigh the pros and cons, the risks and opportunities. Why is it so interesting? Because this therapeutic topic harbors a major potential for growth as such. A few figures and statistics. I do not want to elaborate on it very long. In 2017, the pension insurance schemes, we're talking about more than 1 million applications for pension insurance that were granted. So more than 1 million people did some therapeutic measures via the health insurers. This is a tremendous amount. These are people who then could be then treated by means of EMS, supported by means of EMS in a meaningful way, because when I know how it works, I can fairly riskless work with EMS and maybe even as an alternative to a rehabilitation application. I could say, come on, you choose a reasonable high-quality studio for 1-2 years with people who work well, then you might not run the risk of having to take this rehabilitation treatment and the services. So in the long run, we could then get some of this potential customer base. Part of this particular pie could then belong to us, and we could divert them and provide our services. When you take a look at inpatient rehabilitation, we go back to the pension insurers, and you see a wide range of potential applications. The largest part is accounted for by musculoskeletal. This is a clear thing, your back, etc. Then heart, then cardiovascular area, neurology, etc. All areas which for classical training are a contraindication because people have got tangible illnesses, they've got medical diagnoses to go with it. Now, when I know more about the medical backdrop of these sicknesses, when I learn to understand the medical bedrock, I quickly learned that when I implement EMS based on certain therapeutic rules of the game, I do stand a chance of reasonably working with the majority of these people by using EMS as a tool. I simply have to make sure that the quality of my work is the right one. This quality criterion is something we will jointly deal with, where this problem is from the point of view of the therapist and from the point of view of my colleagues who jointly developed the concept with me. There are some areas where there is an urgent need for action if I want to take the medical approach to this topic. Looking at overall figures, it's mind-blowing. Even as a therapist, we don't. It's difficult to fathom what amount we are talking about. It's only prevention, rehabilitation, and medication. This is physiotherapy, etc. What we are talking about is overall expenses of nearly 10 billion euros for 2016. 10 billion euros that are, in inverted commas, only spent on prevention, rehabilitation, and medication. Now, if we add the individual health services, which are also paid, in addition to that, we may add another 1.5 billion. So what we are talking about is nearly 12 billion euros in terms of market potential. And the market which comes into being is partly covered by the classical rehabilitation treatment in a hospital, inpatient treatment. It includes physiotherapy, rehabilitation, sports, etc. So the potential actually does exist. And when I am able, if I was able to come in and be instrumental with my knowledge and my capabilities, there would be potential in the market, or provided that I know how things work. So it's dedicated, targeted application of the system. And when at the end of the day we look at the individual area, I'm asking myself today, so why are we not selling EMS? Doctors can sell things, whether it's meaningful or not, sometimes questionable, but there are enough people who spend money for receiving an additional service. And when the quality of the service is okay, people are willing to spend money on it. And when at the end of the day this service is highly beneficial, so that they say, I feel a lot better than before, then the benefit, the advantage is even higher. And when I can implement this measure with people who've got severe physical ailments, I have won. So I tackle so many points simultaneously so that the whole system of addressing this area makes sense. If you take a look at it from the economic point of view, with reason, you say there is a potential, the fitness market is quicker. in terms of the fitness section, taking a more medical-based approach, medical fitness, and the job of a therapist, they are actually making money here. They've got a major problem of serving this market in a reasonable way. It wouldn't be bad if we could come up with a symbiosis of the two. It would be an optimum solution. It's not who can do it better or worse. It's simply a description of the status quo of the as-is situation. Tremendous market potential. And when we take a look at the favorite topic of the Germans, back pain. Well, who hasn't got that? Each and every one. 80% of the Germans, they suffer from back pain at least once in their lives. So welcome to the club. Nearly everybody's affected once in their lifetime. When you take a look at the problems they are fighting with, it's, non-specific problems. They simply suffer from pain in the back. And so here we've got the people, the patients, the customers that hit the micro studios. They come along and say, I've got here pain in shoulder, in my neck, I've got a headache, back problems, can you do something? And then they say, yes, sir. And when they say, well, had a prolapse, then I say, as a micro studio operator, well, slip disc, I don't know, should I, can I, am I allowed to? Medical indication. Some try, nonetheless, others stay away from it. But you feel that when you work with them, they also feel better. And when I've got some additional background knowledge as to why it's better and what the trick is, then it's even better. All the factors that play a role as to how this non-specific back pain comes about would take us too far. What's a fact, however, is that with very simple auxiliary means we can train in Waldenburg. I learn to detect the symptoms of these individuals to be able to safely say, okay, I engage in training with you or not, or I have to lift it on a different level in my work, and this is the medical therapeutic approach. And there are plenty of epidemiological facts and figures. Just look at the year 2017. 65% of all women, 57% of all men suffered from back pain. And this is crazy. This is mind-boggling. This is tremendous. So 62% of all Germans last year was suffering from back pain in certain situations. Age groups, unbelievable how many, suffered from pain only recently. So my hit rate when I only specialize on back pain is very high. I could say I do something with you before you, are hit by back pain, or whether you do it afterwards, post pain, it always works. And then you have to take a look at what is out there, apart from the problems, maybe depression, additional pain in the knee joint, mobility issues, etc. I can also take it on board, and in Baden-Württemberg we say we also tackle it just along the way. So this is what makes sense. When we take a look at the absence from work, the sickness days, we've got a high areas in 2017 for 100 people insured, more than 100 days incapacity to work on average every year. This is really crazy. It's extremely high when you think about back pain and the result it has on people's capacity to work. When you own your own company and you see what funds are lost to the company or to the industry, you have to clearly say as an HR responsible that I have to do something with my staff, because the probability that once a year they cannot work due to back problems is extremely high, whether they are in a sedentary position, whether they will have to do physical work during their work a time at the workplace, or no matter what, people who work, that they've got their illnesses and ailments, and they will be in favor of doing something about it, and they are motivated to do something about it in an active way. And now we've got this EMS. There's a highly efficient back training, high benefit within a very brief period of time. People go there and it works out. And now they've got a diagnosis and they are told, well, I'm sorry, I would like to take you, but I'm not allowed to. Then they are frustrated. Then they go to, a studio where somebody has got medical knowledge, and they could say, well, I take a look at that, see whether I can give you restricted training or full training, or whether you are part of this group of persons who I cannot help. So I've got somewhat more potential in my studio to make money and to generate a satisfied customer. And breaking this further down regarding working life, professional life, again and again we come up against problems of forced positions, sedentary positions, lifting, carrying. So the problems people are suffering from are pre-programmed, are well known. I can ask them, I can include them in an anamnesis. And this gives me my tool to say, well, after 3, 5, 10 times of interventions of training, do you still suffer from ailment while you are in this upright position? If not, have things improved? Can you stand up longer than before? When you lift something, when you're carrying something, how do you feel? Do you still suffer from back pain? Better? Well, a subjective opinion is enough. The customers, they simply want one thing. They would like to have an advancement of their quality of life. They want their pain to be relieved. How do I achieve it? Well, it doesn't matter, but by means of EMS, it works a lot better. Everybody who uses it knows it works. And then orthopedic topics, classical lumbar syndrome, shoulder, neck problems, whatever, you name it. They also form part of what we tackle. You simply take it and your stride. So I do not have a crystal ball. It's sort of out of order. I would love to know it. I just imagine that I could do some witchcraft here, and I could change the world, just overnight. Whether it would go into that direction, I would like to see it go. I don't know. I would like to put the EMS topic and move it up, shift it to a higher medical level. What would it look like? And it's still a wish I'm voicing here. A fairy gave me 3 wishes, and I said I wish that everybody working with EMS would safely and risk-free would be able to distinguish between a training individual, a customer of mine who approaches me, or is it a patient, a half a patient, or a fully fledged patient standing in front of me requesting my assistance. And there are 3 building blocks who safely and easily help me to distinguish between these 3 groups of different people approaching me in my studio. If I had a second wish, I would say, okay, these 3 building blocks are nice, but it could be even better if I added my second wish. Then I would like to see that this working therapist or instructor would have a first contact questionnaire, diagnosis, anamnesis, and that this person learns other things. That would be my second wish, and then I would be satisfied. Because when we get these 6 building blocks, if everybody mastered them, everybody working with EMS mastered this, there would hardly be any restrictions for people who approach me on the basis of tangible problems and issues they're suffering from. So what do we have? What is the reality we are faced with at the moment? And don't misinterpret what I'm saying now, understanding that I am criticizing the system we've been working with until now. No, it's simply a reality that doesn't allow us to work in a more therapeutic sense. Very rarely in the fitness area do I have sufficient individual anamnesis and diagnosis. more or less, they do have done more in the past 3 to 5 years, but we are still far away from a therapeutic point of view, I would have to say this would be a clear yes or no. The safety first principles, most of you are familiar with them, but they are only rarely applied. What do we have? Often we've got wrong intensities or too high in most of the cases. In some cases, sometimes, in some areas, there is planless setting beyond the abilities of the patients. On Tuesday, the ZDF had a report, a broadcast, and they also talked about EMS. And then the moderator gave a little statement of EMS and said, well, you have to be careful because when you do not tense your muscles early enough, you get an electric shock. And this is a problem where I say, as a therapist, this is a no-go. It simply must not happen that a customer or a person with real pain is so extremely well treated with currency that they get sort of half electrocuted. And then the sports scientist from Hamburg added, well, when the intensities are so high, there might also be problems. Well, of course, you don't start with high intensity training and squat while carrying 400 kilos, but nonetheless, it's done in the fitness level. And this would be a point of attack, so to speak. And very often, the selection of exercises, there are great catalogs, standards, but a standard always has got one problem associated with it. It's not individualized, and so less is more sometimes. Easier exercises are maybe good. It's less a theater, but you have one tangible exercise. You continue doing it until it is well coordinated and performed 100% correctly. For most people, this is enough. They don't need any additional weights. They simply have to stand accident-free, lie accident risk-free, and even that they don't manage to do. And even if we imagine that they are walking, keep it simple and stupid. Yeah, and this is enough. But you have to be clear about the fact that this suffices. Often we think that we have to do a lot more because it's supposed to be fun, it's supposed to be motivating, it has got this animation character. No, training is no fun. Well, Sebastian put it nicely. He said, I've got the exertion, I've got my training parameters, I have to comply with them, otherwise I will not increase my performance. And when people are suffering from pain, it gets more and more important. And these rough coordinated movements, and then fine coordinate the movements, and then making this available in a variably that no matter which stimulus comes, that I still can perform the movement without any risk. This often doesn't exist in the fitness scene. And when I've got a person suffering from pain and ailments, I have to take this into consideration: the complexity, the simpleness of an exercise, etc., clarity of it. When I, as a training person in the EMS, have to decide in favor of a more medical level, I have to be willing to address this medical special knowledge. I have to look at the shortcomings of the fitness market, which currently still exists. I have to be willing to make a change right there, to open up the path for a target group, to tap a market which is tremendously huge. Always bear in mind that 80% of the population suffer from back pain at one particular time. So, potentially everybody is a customer or a 50% patient, because because they might already be suffering from issues. And we probably found this approach to a solution via medical therapeutic work, including several stages of quality. And this, at one time in the future, is to be embedded in a therapy principle. Then there's also a registered trademark, my colleague and myself, so that it turns into a quality seal, well, indicating the quality of working, for medical purposes in EMS. What the medical sector shows us, we as Waldburger Training Institute, this is something we would like to establish for this theory. We've got the synergy, the fitness market is more professional, has got qualitatively enhanced training, and all those who would like to work in the medical field, they take up training in Waldenburg, and then this thing is rounded off. And depending on how far I would like to go, this modular principle is infinite. Well, why? Because it always depends on what I know. What is the level of my knowledge and expertise, and how much of it can I use in a targeted way? This is where we try to be instrumental and come in. We hope that we will be able to do so. We've got strong networking partners, starting with Glucker, and they do an outstanding job there. And I say kudos. Well, and then Spolastic, who offer then modules for physiotherapists, and then Miha, just with other devices it's always possible. And then with my colleagues who in the therapy area stand for first quality training. It's our brand name which is known, and we are working on this at the moment. So this was all on my part, and I hope that I could give you a taste of what it is medical, the medical side, that things turn more therapeutic. I would be happy to see you at one particular time in terms of further training, that we then form partnerships. Well, when you look around, it's therapists, they're always wearing white, a white polo shirt. Well, thank you very much for listening, and then enjoy your stay at FIBO. Thank you very much.